Hey guys, welcome back to my channel. Today I'll be talking about right atrium. Right atrium, it's a quadrangular shape present on the right side and behind the right ventricle. It has a small projecting structures called the auricle, right auricle. See, this is a slight projecting structure in the right atrium called the right auricle. So first let me talk about the external features. So look at this diagram. It is an elongated and vertical structure which receives a superior vena cava on its upper side and inferior vena cava on its lower side. And this right auricle, which is an elongated structure, it covers the root of the aorta, if you could see here, and also a part of the infundibulum, which is the small upper portion of the right ventricle. Externally, we could see a shallow vertical groove called the sulcus terminalis that extend on the right border here from superior vena cava to the inferior vena cava. The sulcus terminalis in its upper part itself will be having the SA node. So in its upper part, that is slightly in this region, we will be having the SA node. The right anterior AV groove or atrioventricular groove or also called the coronary sulcus. This is the one. Right anterior AV groove or coronary sulcus. It lodges the right coronary artery and small cardiac vein. Small cardiac vein. Now coming to the internal structure. It will be having a smooth posterior structure called the sinus venerum and rough anterior structure called the atrium proper. Both of them get separated by crista terminalis. The smooth posterior part, it is developed from the right horn of sinus venosus, and the rough anterior part is derived from the primitive atrium. So all the venous channels except the anterior cardiac vein, they drain into the right atrium. And I'll show you here. This is the smooth posterior part, which is smooth, and this is the rough anterior part. So both of them get separated by this crista terminalis. Now coming to we could see on this rough anterior part, we could see a series of muscular transverse ridges called musculi pectini. These are the transverse muscular ridges called musculi pectinate. This muscular pectinate, they arise from the crista terminalis and run towards the auricle. So from the crista terminalis, they arise and run till towards the auricle. And inside the interior to the auricle, you find a spongy network of muscular ridges like this. This you find the muscular ridges. Septal wall. The septal wall is derived from septum primum, septum secundum. The septum primum, it forms fossa ovalis. This is called a fossa ovalis, a shallow oval depression in the lower part of the right atrium. Actually, it is a site of the foramen ovale in the fetus. Septum secundum, it forms annulus ovalis or limbus ovalis. This, what do you say, the margin of the fossa ovalis, the distinct upper and lateral margin of the fossa ovalis, and which is inferiorly continuous with the left valve of inferior vena cava is called annulus ovalis. Annulus ovalis. This is the structure you could see here clearly. Right auricle, superior vena cava, inferior vena cava, fossa ovalis. There's a depression and the margin, upper lateral margin is called annulus ovalis. Now coming to the openings of the right atrium. We'll be having totally 5 openings. Opening of superior vena cava, which will not have any valves, which will drain from upper half of the body. Opening of inferior vena cava will have a valve, but it is rudimentary and non-functional semilunar shaped called the eustachian valve. This eustachian valve, this returns the blood from lower half of the body. Opening of coronary sinus, which drain the blood from heart into the right atrium. It is present between the openings of inferior vena cava and the coronary sinus. So it has a valve which is also rudimentary called the Thebesian valve. Right atrioventricular orifice, a communication between the right atrium and right ventricle, which have a tricuspid valve between them. Many small orifices for the small veins called venae cordis minime. So let me show you here. It's an opening of superior vena cava, no valves. Inferior vena cava will have a valve, rudimentary, non-functional, called eustachian valve. And this is the valve of coronary sinus, and this is the right atrioventricular orifice, and these are the small holes for the small veins called the venae cordis minime. Okay guys, thank you for watching my video. If you like my video, please share it with your friends.